will ARNI arrest the progression of heart failure in my patient with HFrEF? Definitely, it has shown that once you give ARNI in heart failure patients, the rate of mortality decreases, rate of hospitalization also decreases, quality of life also improves. But whether it will slow down the progression of heart failure, that is the basic question in the mind of the physician. So let us see. The paradigm HF trial demonstrated the superiority of ARNI over enalapril on both death from any cause and on death from cardiovascular causes. A post-hoc analysis of this trial evaluated the incremental effects of ARNI over enalapril on the non-fatal progression of heart failure in surviving patients. So the results were very promising, and they showed that as compared to enalapril, ARNI was associated with 16% reduction in the outpatient therapy intensification. That means that patients were not going for intensive therapy once they were already on ARNI. So they required no more drugs. Then there was 34% reduction in patients with emergency department visits for worsening of HF. That is not only hospitalization decreased, but even to visit to the hospital decreased by at least 1/3. And as you know already, there were 23% fewer hospitalizations for worsening of heart failure with the 18% reduction in requirement of intensive care. And most importantly, 31% reduction in patients receiving IV inotropic drugs. So this is very promising that 1/3 of the patients will not require any IV support. And the most promising, because it involves cost reduction also, there was a 22% reduction in patients requiring cardiac device implantation or heart transplant. Let me remind you that once these drugs fail, we have to go for CRT or what we call as a biventricular pacemaker. And once you use ARNI, you can reduce the number of implantation by nearly 20%. So also among surviving patients, a significantly lower portion were considered by the physicians to be worse in the ARNI group as compared to the enalapril group, both at 8 and 12 months of follow-up. Thus, I would say Azmarda prevents the clinical progression of heart failure more effectively than the current standard of care, which means enalapril or ACE inhibitors.